attendee numbers have slowed down, so we shall begin. So good
Okay.
morning and welcome to the second in our series of webinars informed by a groundbreaking new report, The New Reward Director. Today I'm joined by Liz Naulls, Head of Strategic Partnerships at Lime Insurance. Good morning, Liz. How are you today?
Good morning. Morning, Gethin. Good morning, everyone. I'm great. Thank you for asking. Yeah.
Thank you very much for joining us, and thanks for attending some of our previous webinars.
Sure.
Appreciate the support. So one of the standout results from our new reward director research was the admission from almost every single reward director that we spoke to around the world was that employee wellbeing was at the top of their agenda for the next few years. But as we move from just offering more well-being to staff, we see that reward directors are increasingly approaching people like me to ask very specific support. And one that's been asked recently in the UK has been, how can I have a greater impact on employees with helping them with the things that are standing in their way? And
Mhm.
namely, at the moment, that seems to be NHS waiting times.
Mhm.
Um, Not new to the pandemic, how long somebody might be expected to wait for elective surgery on the NHS has become a growing problem. But even in the IFS's most optimistic scenario, the number of people waiting for treatment on the NHS in 2022 would probably reach 9 million, which would require the NHS to increase its already stretched capacity by an additional 5% next year and 10% by 2023. So it's kind of, I guess, no surprise that this is impacting the workplace. People Management reported a few weeks ago that half of employees say they've been affected by the NHS backlog. Is this something you're seeing in your world?
Yeah, sure. So it's quite a lot to unpack there, Gethin, and it's a great place to start. So I think first off, I think it's apparent to us certainly that reward directors, HR directors, benefit designers, they can't ignore the growing noise that is coming from employees around this stuff, right? So I think it's pretty fair to say that employees are probably more vocal, more demanding, and probably more engaged than they've ever been in their health and well-being, which is I think a positive thing. I think for a long, long time, the wish list of a benefit director has been, I wish my employees could be more engaged, particularly in health and well-being. Well, guess what? Um, if there is a silver lining from any of the stuff we've been through over the last 2 years, is that actually people are I think employees are much more engaged in their own health and well-being and that of their friends and family. So, that is a great position to be in. But that comes with a bit of a cost, right? Because employee benefits directors, HR directors, they can no longer ignore the fact that actually perhaps their benefits, the stretch of their well-being and their stretch of their health benefits perhaps is not as broad as it should be. And certainly the noise we're hearing is that in market there is relatively few provisions for benefits that stretch across whole of workforce, particularly those that are more affordable than, say, traditional medical insurance. And tackling those big ticket items like NHS waiting times, if you've got a private medical plan in place for, say, your top 10 or 12% of employees, clearly those employees are really well served and they can navigate their way through that. But for the majority of employees, particularly those on sort of modest incomes, low to modest incomes, they are coming up short because there isn't a huge amount out there for them to purchase privately. And certainly from an employee benefits perspective, there isn't a huge amount on the option sheet, if you like, that helps them deal with that. And I think none of us can ignore the noise around NHS waiting times, and the outlook is that that is not going to get certainly any better in the short to medium term. And in fact, the likelihood is that the NHS will become more and more constrained. I mean, that is pretty much true wherever you look. And so I think it's increasingly important for employee benefits directors, for HR directors to be able to find benefits that can alleviate some of that healthcare anxiety associated with waiting times, because I think that's what we're talking about here. It's not just the physical impact of waiting for a diagnostic test, for example, or waiting for treatment. It's the healthcare anxiety that comes with that long wait. And I think that's perhaps something that's a little bit overlooked. And certainly at Lyme, we've been working really, really hard to address issues like healthcare anxiety caused by waiting lists and help ordinary employees, those on low to modest incomes, navigate their way through those waiting times by bringing to market products such as rapid diagnostics.
It's fascinating, isn't it? Because I think the NHS waiting times have been they've been in the news long before the pandemic, right? It was kind of they've been here for a long time. The NHS has obviously been massively underfunded and not perhaps supported in the way that it should have been for quite a long time. But I think it's fascinating the fact that within the space of about 1 week, 3 customers said, how are we helping to support people with
Sure.
NHS waiting times?
Sure.
And that prompted me, anyone who knows me, to want to find out as much as possible as I could about NHS waiting times. And I think what was fascinating was, for emergency surgery, for the cancer diagnoses and things like that, people were getting the support they needed pretty quickly. And so those waiting times were obviously being prioritized, but it was the elective surgery that was causing a problem for people. And we were seeing, some general surgeries. So some of the most common things like knee replacement, gallbladder, gallstones, those kind of things. People were waiting, depending on where you lived in the country, up to 52 weeks in some
Yeah,
cases.
sure.
And so exactly as you mentioned, it's not just about people living with the physical discomfort of waiting for surgery, but the mental health impact of that and the stress and that might be
Yeah,
causing them. And clearly that's having an impact on the workplace because those people might not be able to work in
exactly.
the way that they used to, or even turn up to work as much as they used.
Exactly. And as an employer, you want your employees to come to work and do their best work, whatever that work is. You want them to come to work, free from anxiety, free from issues which may be affecting their work on a daily basis. And if if you're at the start of that healthcare journey and you can't even be seen for a diagnostic test to uncover if there is actually something wrong, that will weigh heavily on your mind. Regardless of what role you do, that will have an impact on you as a person, and that will impact on how you perform as an employee. So, the human element here is a really key one. And, at a broad level, the things around sort of absence and productivity, of course, those are the metrics that are going to start to show, as the NHS creaks and groans under the weight. It will, and it is already, I'm sure, starting to come out in the results of, where absence is measured, where productivity is measured. And I think the challenge that we're trying to address is that in market, unless you are lucky enough to be offered that sort of full fat traditional medical insurance, there is a real dearth of kind of options available, either to you as an employee to give that to your staff, or for you as a private individual to go and sort of try and alleviate some of that, some of that pressure and some of that anxiety directly. And it's not about sort of bringing products to market that are necessarily really, really cheap. It's not necessarily about that. It's bringing products to market that actually start to address some of those big healthcare concerns that we've just touched on. And certainly the way that we're trying to address that is to digitize as much of that sort of customer journey as possible, sort of remove some of the sort of inefficiencies that maybe existed previously, and sort of put the customer back in control of that healthcare journey. So if they want to, they can access private diagnostics, for example, in really, really fast time. They can get that diagnostic test and have their results back very, very quickly. And that is, that really is alleviating that sort of healthcare burden on them personally. And I think there's a moral element here that we're certainly hearing from employers around, well, what can I do potentially to alleviate the burden on the NHS? So, it's working on two levels, I think. And certainly the feedback we're getting has been very, very positive.
And I'll pause there. If anyone wants to submit any questions for Liz or about the products that Lime are offering or how we're working with Lime, please submit those through the chat or Q&A functionality. We'll get to those as you submit them. I think it's a really interesting point you raise about, when we look at private medical, Benefex and our healthcare team would I guess always recommend private healthcare for employees. It gets people the support they need as quickly as possible. It gets them support closer to them, and so but it is an expensive benefit, and I think there's an increasing demand from people to offer benefits that can support people but don't have necessarily the cost associated with them. I think what's been fascinating is we run the risk, and you mentioned this earlier, of many organizations having this kind of two-tier system. And I was presenting to the executive board of one of our customers this morning, and that was one of the questions that was submitted was, should we be offering benefits to some people and not others based on who they are? Now, clearly, employee benefits can be used not just to attract and retain people, but to attract certain types of people with certain skills. So typically, you might have a C-suite or senior leadership team that has an expectation that you will offer things like private medical insurance. So something we commonly see is that an executive team might get that benefit, but everyone else doesn't. And I think what tends to happen then is, you mentioned it, about this two-tier system of those people who can afford it get the private medical care, those who can't have to just rely on the NHS. And when I was looking at some of this data, 1 in 5 patients said they're now going private because they can't wait. So
Mm-hmm.
from just a couple of months ago, sees that, you know, these are real employees that are going private and spending their own money. And we've heard from customers, people digging into savings, selling shares, and doing all sorts to be able to fund that care just to remove that discomfort. And, you know, 1 in 4 said that waiting for treatment was having a serious detrimental effect on their mental health. So again, the stuff that you've mentioned.
Mm-hmm.
One of the reasons why we teamed up with you was your rapid diagnosis tests.
Mm-hmm.
I think this is really an interesting point about how can employers do what they can with what they've got. So if you
Mm-hmm.
can't afford to give private medical insurance to everyone, can you start looking at ways that how can we solve more problems for people within the confines of the resources we've got available to us? And this is one of the things we loved about Lyme and why we wanted to partner with you, was because we felt that actually we can't remove those waiting lists. We can't pay for everyone to have private care, but can we have an impact on some of those waiting lists? And so, you know, when I looked at the research here, I think it was 2008, the NHS introduced a diagnostic wait time of 6 weeks, and that was kind of their target. That milestone, I think, was created in an attempt to make sure that no one had to wait longer than 6 weeks to get a test. But as I mentioned, as a result of COVID, those kind of waiting lists are now being prioritised according to clinical need, which means those people with elective non-emergency surgery are having to wait even if they're in discomfort.
Mm-hmm.
And that's meant that non-urgent wait times in some parts of the country have more than doubled. I
Mm-hmm.
thought what was fascinating with the research I did is that there were some of the, it was common surgeries. So I think that one of them was a chest surgery where the waiting list in the Midlands was around 500 people waiting for that surgery. But the same surgery down in Devon or Cornwall was only one person on the list. And so massive postcode lottery based on where people lived, how long they had to wait. And I think as of August, 130,000 patients were waiting for more than 3 months just for a diagnostic test. So that 6 week target blown out the window. Queues for kind of vital tests have doubled because of COVID. That includes MRI scans and heart scans. So people are waiting a long time for this stuff. So yeah, I just wanted to talk a little bit about the diagnostic, rapid diagnostic tests and how you think that might counteract some of the things we're seeing with the NHS at the moment.
Sure, sure. And Gethin used that sort of term, postcode lottery, and it's one that's used, you know, quite commonly. And I think again, what it speaks to is just that almost that sense of powerlessness that a lot of people feel. And this is not to say that the NHS is not doing a phenomenal job in unbelievably difficult circumstances. And, you know, I absolutely get that out there. And I think the increase in funding, which it absolutely needs, I think, and the increase in capacity it absolutely needs, can only happen at pace with the number of medics and clinicians available. And, you know, they're absolutely, you know, working as hard as they can to alleviate that backlog. So I think there is absolutely not a sense that the NHS are not doing everything they can to alleviate that backlog and to, you know, to see as many critical patients as possible. And I think that's the key here, is that it you know, is being prioritized based on clinical need. And, you know, that's not to say someone who has chronic, you know, really awful knee pain, which is keeping them awake at night and stopping them from potentially even being able to get to work or playing in the park with their kids or doing their gardening, whatever it is, that is not to diminish, you know, the impact on their life. It is just an issue with how many, you know, physically, how many people can the NHS see, particularly given the restrictions that have been in place for such a long time due to COVID. So I think there is this real sense that control has been taken away from patients, because there is this layer of, you know, it's really, really hard to navigate. It's really hard to see how, as you say, in one part of the country, you know, 500 people can be waiting versus others, there might be one. So that sort of inconsistency and that sort of sense that it's very, very hard to navigate and be in control of your healthcare, that makes people feel really, really helpless, right? And you know, that level of healthcare anxiety just creeps up the more that is in the media and in the news, and we can't escape it at the moment. So rapid diagnostics is one of the products that is available from Lyme, and that was brought to market primarily to tackle exactly what we've just been talking about. So the diagnostic part of a healthcare journey, and as you say, that 6-week target is routinely not being met for hundreds and hundreds of thousands of patients, and that is having a significant impact on those individuals and on employers. And this is all about being able to offer patients access to a GP digitally. So again, that is a potential bottleneck for a lot of people not able to access their GP when they need to. And it's also being able to give people access to private facilities for diagnostic tests, so alleviating the burden on NHS scanners, NHS MRI machines, and being able to give them access to facilities that are near to them locally within private provision. And it's not just about, diverting them away from the NHS. It's actually also about being able to give them access to appointments at a time and a place to suit them, because again, you do lose that control, and particularly if you're working or you've got family commitments or both, like a lot of people I'm sure do have on this call, being able to being able to navigate an appointment at 11 o'clock on a Wednesday if you've got work commitments is actually quite tricky. So there's two things here. It's alleviating the burden on the NHS, which is obviously great, and that works both for from an employer's perspective for the reasons that we talked about. It's quicker access to the diagnostic tests that are required, but it's also giving an element of control back. And I think what we're not saying at Lyme is that we can wave a magic wand and we can cure all the problems that exist in the NHS. Of course we can't. What we're trying to do is find ways to help employers and employees affordably solve some of the challenges that exist in the NHS, and access to diagnostic tests is a really, really big one. I'm really, really proud of that product, and also just the feedback that we get from customers that have used it, and customers that are going through that journey. It is like a light being switched on. That's the only way I can describe it.
And I think it's pretty useful, I think, for the next, coronavirus is a fast moving situation again, right? So, we've had restrictions in England as of today. What happens throughout kind of January and February, kind of go through the winter, who kind of knows? And so many employees have got very different risk profiles. So, the idea of what they're feel safe to do going into a crowded NHS hospital or a less crowded private hospital closer to home plays into this as well, and this decision making. But I think all of us and anyone on this call will be familiar with, even if they don't have personal examples, family and friends who have managed to get on a consultant waiting list a lot quicker, big through private, and then take that treatment pathway back to the NHS. And I think for anyone who doesn't know, it's important to understand there are two almost waiting lists, aren't there? There's the waiting list to find out, do you need help, and do you need, what's going on with you? That's to get the diagnosis and have that conversation with a consultant or GP. And then there's a separate list, which is the waiting for the surgery. And it's specifically the elective surgery that we're talking about that seems to be the problem at the moment. But the other kind of thing I wanted to talk to you about was the emergency surgery, and one of the most common of those would be things like cancer, right? So that's something that's affecting a significant number of people. We know how prevalent that is. In the last week alone, I know two people who received a re-diagnosis and a diagnosis, one of which is 2 years younger than me, 38-year-old friend, bowel cancer, no history of cancer, very active, healthy lifestyle, completely sidelined all of us and the family. It's happening more and more, and I guess as we age, we tend to find more people that are suffering too. But something that isn't talked about too much, and I'm really interested in this. I wrote an article for HR Zone 3 or 4 years ago about the high cost of falling ill and kind of the financial impact of a serious diagnosis like a cancer. And I wanted to talk to you a little bit about that. And just to frame that, my research found that Macmillan said the financial impact of cancer in the UK equated to spending an additional £570 a month. And that included additional costs due to just because of a cancer diagnosis, including regular trips to appointments and hospital visits, increased cost of staying at home, reduced income, and then there's also some increased costs for some kind of therapies that people might be paying for. And a third of people said that their cancer diagnosis meant that they incurred additional costs for things like clothing and specialist equipment and home modifications that were not paid for by the NHS or anyone else. And so I wanted to talk about how much of an issue is that, and how much do you see in your world about kind of it not really being talked about, that diagnosis comes with a financial impact.
Yeah.
How you guys are supporting that as well.
Yeah, it's a great question, and I think this is it's one that's close to a lot of people's hearts that are on this call, and I think it's where Lyme started, if you like. Lyme looked at the issue of cancer and the impact that has on ordinary people's lives, both the clinical impact, so actually the impact on your physical health, but the emotional, the mental impact as well. And you mentioned the financial impact, and that is probably the thing that is, yeah, as you say, probably the thing that is considered last. But fundamentally, that is, that is a thing that probably gives most patients a huge amount of anxiety, particularly those that are on low to modest incomes, that perhaps don't have savings, that don't have friends or family they can rely on. That is the sad fact. And the Macmillan report you're referencing, it was really very stark. I mean, it surprised me. I mean, I've been working in this sector for a long time, and I looked at that and thought, that is an awful lot of money. I mean, over £500, nearly £600 a month. And it's those small incidental costs that you don't consider, additional childcare, additional food costs, additional heating, all of those things, they add up. And I think that, the reason Lyme started with a cancer product in market, because it's such a significant issue. It affects so many people, and as you say, that some of those impacts are really under the radar. And Cancer Essentials, which is our cancer product, it is all about alleviating the financial burden, the emotional burden, and the clinical burden. So it's about sort of unpacking those things and giving customers access to services and insurance that really will help them in those moments of need. And again, in the same way we were talking earlier, this isn't about curing all the issues that are happening in the NHS. This isn't about offering customers full fat medical insurance to cover all of their medical bills associated with that. This is about finding a balance between offering really, really cost-effective, affordable insurance and that sort of cushion, that safety net, that there is something there in the event that the worst happens. So it is about offering access to a small financial cushion. So in this case, it's £5,000 upon diagnosis, and access to up to £100,000 of cancer drugs. So we talked about a postcode lottery. Again, from an anxiety perspective, that is something that we know really, really worries cancer patients, is what if the NHS can't fund my care? And again, we were really clear that we wanted to make sure that there is a significant amount of funding available if the cancer drugs, the cancer treatment that is needed can't be provided by the NHS. That's where that funding kicks in. And I think probably worth mentioning, certainly, during the pandemic, and we're hearing this more and more, even now as we hope to start coming out of it, those sort of soft services, so those emotional services, those practical support that perhaps was there a few years ago in the form of those amazing cancer nurses and cancer support staff at the NHS, because of the constraints and because of the demand, it's increasingly difficult for patients to get access to those nurses and that sort of emotional and practical support. And that's one of the things that we've thankfully built into our product, because we know that it's not just the cancer patient, it's also their friends and family that may need some additional help, or in addition have questions around some of the practical elements of treatment. So it's about that sort of tripartite, if you like, approach to cancer cover that just gives people that peace of mind that actually, if the worst happens, there is something there. And this isn't about replacing much more expensive products. This is about giving people access to something that, as I say, just provides that cushion, that safety net in the event of a cancer diagnosis.
And these types of benefits, I think, are indicative of what I see lots of employers trying to do at the moment, which is just to help in whatever way they can.
Yeah. And
so it's identifying an employee is struggling or may struggle with something, and how do we support them with that? Because we can't remove things like cancer diagnosis. None of us can have a really significant impact on NHS waiting lists, and we know that there are exterior factors affecting that at the moment. But it's identifying that employees might be struggling with something. And like I say, the Personnel Today research found that half of employees said they were affected in some way by the NHS waiting list. And then getting them the ability to either soften the blow or soften some of that pressure, or if possible, remove that at all. We've had one question in. Please submit any questions you have about the products, about things we're talking about, your own experiences in your own businesses, about what you might be doing to kind of ease some of the burden of NHS waiting lists, or support employees that have got some of those serious diagnoses. So one of the questions we have, this is from an anonymous attendee: is there any impact on getting treatment on the NHS if diagnostic tests have been done privately?
That's a really, really good question. So the answer is, I guess, in two parts. So where you're able to speed up your diagnosis and you're going back to your NHS GP with those results, You are then in the queue for treatment, as you would have been, but ultimately you have your diagnostic test results in your hand. If you have a 12-week or 14-week delay getting to that, then clearly, you know, there is that period of time whilst you're waiting for that MRI scan, for example, that you don't know whether there is something wrong with you. So you can't be put on a waiting list for surgery, let's say.
Yeah.
So whilst we don't and we can't influence how quickly you will be treated, you're essentially, that first part of the journey getting to a diagnosis is much shortened, and it is up to obviously individual NHS trusts and NHS GPs to determine, you know, how quickly and whether they will prioritise you for treatment based on your diagnosis. We can't influence that, and nor should we. That will be up to the decision of the treating clinician. But I think that's the key part here. It's shortening that first bit of the journey and reducing that sort of anxiety, that waiting period whilst you're waiting to find out, oh gosh, do I need surgery on that thing? Or actually, is it something that just needs monitoring? Or actually, is it nothing at all? You know, thankfully, that's the answer you want, right? Actually, it's nothing at all. It's completely benign and you can go back to your daily life. I mean, that is not going to be the case for everybody. But so just to stress, we can't influence the wait. Once you're on that list, that treatment list is the treatment list. It's the first part of that journey.
There was some research that I found that suggested your kind of complete wait list from I need to see a doctor about this thing to get surgery if you needed it could be reduced by up to 70% depending on what you're waiting for, what surgery it was, if you actually got to see a consultant or had a diagnostic test quicker. But you raise a good point there as well about it's an anxious wait for anyone who's waiting for a diagnosis. Really is. Even if it becomes something that doesn't need treatment, shortening that period alone to just get somebody an answer so that they can either adjust to the fact that they'll need surgery or even just kind of give them peace of mind that it wasn't something to worry about is an important part of this product as well.
And I think probably just worth raising, Gethin, we are always working on our product pipeline at Lyme. We don't stand still. We are always looking ahead to how can we keep improving, how can we keep supporting employees, how can we keep supporting our customers with their healthcare and their well-being. And one of the things that we're looking very closely at is how can we help customers who are on those long waiting lists for treatment? What can we do? There is clearly private provision available. There is clearly significant demand in NHS. What can we do to help make some of those treatments potentially more affordable? How can we do that? How can we address some of those pain points in the treatment journey? And we're rapidly coming up with answers. So I guess it's a bit of a watch this space. And again, what we're not trying to do is resolve every single wait for every single patient on the NHS. Of course we're not. But there's certain areas where actually private provision can provide actually fairly cost-effective treatment as and when it's needed. So how can we bring that to customers in the same way we bring our other products and services to customers? So we're working on it. I think that's the just to signpost that we're on the case.
Well, I think what's interesting from a benefits perspective is I think more and more reward and benefits professionals are getting comfortable with the fact that benefits can work together to create an outcome for people. Sure. So you can order a number of different benefits. So for a long time, you've had health cash plan products that will be able to pay some of the excess for somebody's private medical.
Absolutely.
So that kind of gets somebody the treatment they need in a much more cost-effective way. Health cash plans, we see lots of customers use those in tandem with private medical. If it's just offering private medical to lots of senior members of staff and then offering the wider population things like health cash plans. I think Rebecca Rahn from Benefex, Head of Healthcare, has been doing some great work with some of our customers to show actually how products like Lyme alongside a healthcare cash plan can really help employees.
Absolutely.
And that's far away from the cost of some of the private medical. So it's fascinating to see some of that stuff. And for anyone that doesn't already do some of that stuff with Benefex, check out the healthcare that we've got, because we've never had as much expertise internally looking at healthcare and healthcare benefits as we have at the moment. Something I wanted to talk to you about was an issue I didn't know existed until I was doing some prep for this webinar and doing some research. And I'm going to read this directly from The Independent. This is from 2020. Some new and experimental drugs are available in the NHS, but they can be very location dependent. Avastin is one of these, which slows the progression of cancer, so could extend the life of those with a cancer diagnosis. But speaking to The Independent in 2020, Anne Kelk told how after her bowel cancer diagnosis, the drug wasn't available to NHS patients in Northampton. And Anne Kelt's cancer spread, and then her health insurance wouldn't cover the cost of Avastin, as her policy didn't cover secondary cancer. So this lady had cancer, had it treated, it then spread, but her healthcare wouldn't kick in again. It was all paid for by a work company, kick in again because it didn't cover secondary cancer. And this Avastin was a way that she discovered of slowing that second cancer spread down. She ended up saving £2,500 herself to be able to fund her first month, just 1 month of Avastin treatment privately. The drug worked, and for that month, kind of halted the spread of her cancer. Her daughter then set up a GoFundMe to fund any future treatment, and they estimated that it will likely cost her £50,000 by the time that treatment was finished. But it started to do the job, and actually she had her second cancer treated, and she was thankfully went into remission. I had no idea that some treatments would be available depending on where NHS trusts who signed up to that drug or not, which just that postcode lottery comes back.
Yeah, it really it is quite staggering, and there's thankfully what we don't see is this happening hundreds and hundreds of times a week, right? Thankfully, this isn't a common occurrence, and I don't want people on the call to think that gosh, this is happening to hundreds of thousands of people, but it absolutely does happen. It's probably more common than you would hope it is. And even between sort of county boundaries and street boundaries, it really can go down to that level depending on your particular NHS trust. And again, it's that opacity, if you like, of what is available on the NHS, what can I actually get, and the sort of inconsistency. That is so hard for people to navigate, because until you're in it, you don't know. And why would you? How would anyone know that? And they absolutely wouldn't. And so the NHS a few years ago, I think it was 2011, I could be wrong, set up the Cancer Drugs Fund. I will check that. And that did a phenomenal job of plugging some of the gaps that were, opening up around cancer drug treatments. And that was mostly due to the fact that a lot of the experimental and new cancer drug treatments were breathtakingly expensive because of the amount of research and development that had gone into developing those drugs. And actually, the NHS were looking at that and saying, well, we just physically we can't afford to give these drugs to as many people that need them. So the Cancer Drugs Fund did an amazing job in the beginning of sort of plugging some of those gaps. But over time, the budget for that went up and up and up and up, as obviously NHS funding was more and more stretched, and money's being tipped in at the top, but it's just it's pouring out. And so the Cancer Drugs Fund is absolutely still there, but even with that, there are still a significant number of patients every year that are finding themselves in that position. And it's interesting, in preparation for this call, I wanted to give you a stat on the increase of people trying to self-fund their cancer treatment on GoFundMe, and I couldn't find a specific stat, but it is. I mean, it's easily doubled in the last year, probably quadrupled in the last 2 or 3. The numbers of people either setting up pages, GoFundMe pages, crowdfunding pages for their own treatment or that of their friends and family, and that is heartbreaking. And then you combine that with stories of people having to sell their houses, move in with parents, move in with friends to fund their own treatment. I mean, no one should be put in that position. And again, this is not a criticism of the NHS in any way, shape or form. They have a finite amount of money and an awful lot of people that need their help. And cancer drugs are not cheap because of the amount of research and development that goes into them. Highly complex clinical trials, highly complex drugs and therapies, and that comes at a cost. And unfortunately, what that means is there are going to be people who are just not able to access the treatment that they need when they need it, and that shouldn't be location and postcode dependent, but unfortunately it is. So we've talked about that sort of healthcare anxiety. We've talked about sort of plugging those NHS gaps and giving people certainty and control over their healthcare. That is exactly what we are trying to do at Lyme, but doing that really affordably. And oftentimes, when you talk about sort of cancer drugs and affordable healthcare, the two kind of don't really go together. I've worked in private medical insurance for a long time, and there are some eye-watering bills that crossed my desk, where people thankfully have survived because of the intervention of their oncologist, and in a private setting they were able to get that very, very quickly. And so, it's quite unusual, for an insurer to be sat there saying, yes, we can do something for cancer in a really, really affordable fashion. And I mean, from £2.03 per person per month. That is where our consumer cancer product starts. And that starts to put, healthcare in the hands of people that need it most really, really affordably. And that is exactly what Lyme is all about. And it's, it's a real, again, it's one of those real light bulb moments, I think, particularly when we get customer feedback from customers that have, purchased our product and they realize what it is they've bought and they just think, gosh, I feel so reassured that this is there. Otherwise, I haven't bought perhaps a higher cost product because I couldn't afford it or I couldn't prioritize that much of my monthly budget. But, £2, £3, £4 a month, I can afford that.
Yep.
And it makes them feel really good about, it makes them feel good about those choices that they've made to protect themselves.
And in this scenario with this lady, Anne Kelks, how would Cancer Essentials have helped her? Because that product does allow people to fund some medicine, right?
Sure. It does.
Medicine.
Yeah. So in Anne's case, the initial diagnosis, we would have assessed that, and as long as the diagnosis was made by a specialist, and that's a recognised diagnosis, a lump sum payment of £5,000 would have been made to her. And should she have been in that unfortunate situation, or should she found herself in where, for whatever reason, the NHS Trust treating her just couldn't fund her treatment, we would make available up to £100,000 to pay for the cancer treatment that was required. And again, that is all on your specialist recommendations. So that is all done in concert with the treating clinician and treating specialists. And we do that really, really carefully. We will handhold that customer through that entire process.
Excellent. Thank you very much. So we're coming up to the last 7 minutes or so. So if you have any more questions, please submit those. If you have any comments or just experiences that you'd like to share, then please do that. One of the other things I wanted to talk about with you, Liz, and we've touched upon this briefly, and when you and I had a call ahead of this, this came out in the conversation, but we kind of hadn't planned to discuss it at all. But something I'm really interested in when we look at kind of ESG, corporate social responsibility, the greater role that employers are playing in the development of society, really, and how we move society forward. And if you think about diversity and inclusion, I see employers doing far more than governments are. And so the changes we're seeing in society, I think, are largely being driven by employers. We've touched upon this a little bit, but there's actually a part that employers could play here in having a positive impact on society by those who have the money to spend, who have the benefit budgets to be able to unburden the NHS with some of these waiting lists. There's almost this social aspect to this as well, isn't there? Where can employers start to free up the NHS for those people who really need it and really can't afford and would never have the opportunity to even have access to some of the benefits that we've mentioned? That came out in my research. That came out in my conversations with you. I wonder whether that employers would start to see that actually by supporting employees in a way that they don't have to lean on the state, that freeing up state healthcare for those people that really need it. I think that's an interesting idea, I think.
It really is. And it's quite unexpected, actually, that the volume on this just seems to be going up gradually. And certainly the conversations that we're having and the feedback that we're getting from out in the market is that this is increasingly a topic, not just under discussion, but increasingly a topic that, we are finding we're being asked about more and more. And it's an interesting one. I think it's essentially reaching us because employers are looking at their existing benefit provision and they're applying the lens that you've just described, which is how can we alleviate that burden on the NHS? Is there a moral obligation for us to do that? And I think their answer to the question is yes, actually, we do feel morally obliged to do more. There is a sort of recruitment and retention element here. Actually, we want to be an employer of choice. We want to be seen to be doing the right things for our staff on behalf of society. And increasingly, I think those employers, those very enlightened, engaged employers, are looking at their existing provision and going, well, how can we do that with what we've currently got? And I think a lot of them are coming up short, not because their existing provision isn't really, really good. Absolutely not. It's just that lens, that sort of moral lens, hasn't really been applied to benefits in this way before, certainly not at scale. And we've talked a little bit on today's call about whole of workforce and sort of that stretch of benefits across more of more of the workforce, that being able to sort of make benefits more inclusive, more equal, fairer. I think there are some themes of that are coming through. So, again, private medical insurance often offered to senior staff and senior staff only due to cost. Completely understand that. But where as an employer you've got the budget and you've got the will to offer benefits more widely, one of the reasons that as an employer you might want to do that is to try and alleviate burden on NHS. And the piece around diagnostics and alleviating the burden on that sort of front part of the journey is a really, really good example of where sort of we are actively helping employers to do that, taking people off the waiting list for MRI scans, X-rays, whatever it might be, funneling them through available private services. And we're trying to do that obviously affordably. So we are proactively doing that, and we will continue to do that, and we will continue to develop products and services that answer that call, because we know that employers are increasingly coming up short when they're looking at their existing provisions, saying, well, how can we use what we've got to do this thing? And they're struggling. So it's a great question. It's one that we've talked about at Lyme HQ a lot. I know Lucy, our head of comms, is on the call, and she'll probably be nodding. But I use the term sort of enlightened employers, and that might sound a strange thing to say, but I think there is this blend of wanting to do the right thing for your employers, wanting to recruit and retain, the best employees, wanting to do the right thing sort of morally, and being able to reward your employees with offering them benefits that actually genuinely take care of them. So I think it's a kind of a blend of all of those things. I don't think it's just one of those things. I think increasingly employers are looking to do more, stretch budgets as much as they possibly can to make those benefits more inclusive.
Excellent. So back to kind of my first thought when customers were kind of saying, how can reward and benefits have an impact on employee well-being through kind of changing the way that we look at benefits. You've encapsulated a lot of that. I think kind of in summary, alternatives to PMI, that is a very good benefit offered by a lot of employers, but it's not there for everyone. It can be quite expensive, so people are looking at alternatives. I think more affordable access to healthcare generally as kind of a plan B seems to be coming out as a common theme.
Absolutely.
Being able to combat that pressure that's building up on the NHS is clearly going to be something that, even if impacting your local NHS in a positive way is just a byproduct of you doing some of these other things, I think thinking of it that way can help you get some of the buy-in that you might need within the organisation. We've kind of talked about taking this long-term preventative and kind of a progressive approach to well-being. The idea of making sure that people are protected so that they can, getting a diagnosis early is long-term preventative. We're not necessarily reacting, we're giving people and removing barriers to how can they get the answer they need as quickly as possible. How do we get them to support and surgery or treatment as quickly as possible? Because we know that the faster that happens, the less likely it is for that illness or whatever it might be to get worse. I think there's some ESG and CSR stuff there about supporting society and the NHS as a whole. And it's just about, as you've mentioned at the start, it's how are we empathizing with employees about what might happen if they got this terrible diagnosis, or they got this terrible anxiety about they think something might be wrong and they're waiting for long periods, even just to see somebody to find out whether it should be something they're worried about. Is very, very anxious. And we've always talked about the employee experiences, about how do we empathize with employees and what they're going through, and then try to make that experience as easy as possible. And I think what you're doing, the products that you've built, are absolutely doing that. We're really thinking about the experience of that employee. And if that should happen, if I feel uncomfortable, if I need to speak to somebody about something that's going wrong with my body, how can I get those answers as quickly as possible? How can I reduce those waiting times? How can we relieve the financial burden of some of these diagnoses? How can we get people access to some maybe experimental drugs that they might not be available to them? And I think all of that really encapsulates this growing need, as you've kind of mentioned, for employers to do more and for benefits to deliver this very clear, we care about you message. And we're trying to remove as much barriers as possible to make you happy and healthy and well. And I think you've really covered that. So any last thoughts from you?
No, I think Gethin, you've summed that up beautifully, as I expected. I think Lime's purpose is healthcare for the many, and it's easy to say, it's quite difficult to do, particularly in a in an employee benefit setting where health and wellbeing benefits have been seen as quite expensive and in some cases quite elitist. What we're trying to do is move away from that, and as you say, alleviate that sort of sense of healthcare anxiety, and really help employees do their best work, turn up to work, and be themselves at work without the fear or without the worry of what if something's wrong with me. Everyone deserves to have that, regardless of how much they earn or their grade. So I think it really is about making benefits available whole of workforce to as many people in your business as possible, and genuinely trying to live up to that purpose that I just stated around healthcare for the money. That is exactly what we're all about.
Excellent. I'm going to give the last word to Lee Gruskin, who's just submitted a comment that I think sums it up really nicely. Great point about the societal impact that employers can make in accessing healthcare. In the UK, we have a loyalty to the NHS, but ultimately it could be that loyalty sees it crack. If employers can facilitate the access to faster diagnostics through the private sector, it could just be the short-term flip that the NHS needs at this time. I think that's a great point to end on. Thank you very much for everyone for listening, and thank you for your expertise and contribution, Liz. Really appreciate it.
Thank you for having me. Thanks, everybody.
Everybody.